And it is now 12:30, so we'll get started so we can maximize everyone's time. Good afternoon. I had been saying good morning, but I should have been saying good afternoon. I'm HeartHealthy from the New England QIN-QIO, and I'll be moderating today's webinar. Thank you for joining us for today's webinar, Zika virus, is your agency prepared? Before we get started, I'm going to quickly review a few housekeeping items. This call will be recorded for training purposes. I'll provide you with details on accessing the recording at the end of this webinar. The phone lines will be on mute for the duration of the presentation, and we'll take questions at the end, and I'll provide you instructions on how to unmute your line. At this time, I'd like to introduce today's speaker, Kathy Roby. Kathy is the Connecticut Home Health Lead for the New England Quality Innovation Network Quality Improvement Organization. Kathy is a registered nurse with over 40 years of experience in home health care. She specializes in quality management, improving home health provider clinical outcomes, and reducing acute care hospitalizations for Connecticut home care providers. Please welcome Kathy.
Good afternoon, everyone. I normally would say I hope the sun is shining, but I'm thinking that everyone would much rather look out and finally see some rain. We've had a bit of it here in Connecticut this morning, and I hope that the rest of you are finally getting a little respite from your lack of rain as well. As I prepared for today, I realized it was almost 2 years exactly, 2 years ago, that I was sitting down writing a webinar to present to agencies on Ebola. So here it is, the summer of 2016, and instead of Ebola, we're talking about the Zika virus and asking ourselves the question, will this affect us as home care providers in New England? If it does, are we prepared? What do we need to know? How can we be as ready as we need to be for this new topic? But the question always is whether or not this is going to affect us. Today I'm speaking to you on behalf of the New England Quality Innovation Network, the New England QIN-QIO. As you know, this is our partnership between health-centric advisors and Qualidigm, working together to provide information, support, education, and encouragement to all the providers in the 6 New England states. Our website is up on your screen, and as Olivia said, we are recording today's webinar and have recorded and posted all the monthly webinars that we've done since the QIN-QIO came into being. In a few days, you'll be able to find today's, and I'm hoping that everyone who is enjoying their vacation this week and sent me their out-of-office message will be accessing this webinar on their return. This is what the website looks like. You will see that fourth from the left is the For Providers tab. When you click on that one, you'll get a drop-down that is going to take you to all the different sections. You'll go to Home Health, and from there you'll be able to access all of our webinars. So as I said, today we are going to be chatting about the Zika virus. Every day on the news, 7 in the morning, 12 noon, 6 at night, we hear something about the Zika virus, just as we did 2 years ago with Ebola. And I have to say, this is a drill. It's only a drill, or is it? In reality, especially for those in New England, influenza is a much greater threat to your agency staff and to your patients than Zika is at this time. We need to be able to look at 2 specific areas of responsibility. As clinicians, whether we are nurses, therapists, social workers, our responsibility is to be as informed as we can be and to make sure that we provide the safe care and education to all of our clients and their caregivers. But we are also community-based healthcare providers. And our responsibility on that side is to provide as much accurate information and responsible guidance to the communities we serve as we possibly can. So in that sense, while the risk to our patients and to our staff may not be a very large threat, it is still our responsibility to be informed and to provide that accurate information to the communities we serve. Let's level the playing field a bit. Let's think about what do we know about the Zika virus. Not what we see in the tabloids at the checkout counter. Not what we caught as a fast 3 or 4 words at the end of the newscast as you ran out the door this morning. But we need to know what is the information we have, what are the facts at our disposal that we can use. The first step in leveling that playing field, I must say, is to strongly encourage each and every one of you, if you were not on the webinar, on the call in July, to hear the webinar that was done by Russ and that whole panel, I would ask you to go back to the QIN-QIO website, download that program, and listen to it carefully. Listen to it at least once, and then go back and listen again. The information in it is technical, but very complete and very informative. We're not going to go into that level of knowledge and detail today because we're going to be talking primarily about what we need to reassure and educate sufficiently our population of patients and their caregivers. So let's get educated a little bit. Today we're going to try to answer these questions. What exactly is Zika? How is it transmitted to the best of the knowledge available to us at this time? What are the symptoms that we should be looking for, that we would ask our patients and their caregivers to report to us? If we've identified a potential suspect case, where would we take that information? To whom would we report that? As healthcare workers, in home health, in the community, what is our risk level? What is the risk level of our patients, and where does that risk come from? How do we screen out and stratify those risks for our staff and for our patients? These are the questions we need to answer this afternoon. So let's begin with what is the Zika virus? From the previous webinar and from information provided by the CDC, we know that this is a viral disease which does have certain similarities to yellow fever, West Nile, dengue, Japanese encephalitis. We know that it is transmitted primarily by bites from infected mosquitoes. It's been identified in human beings since 1952. The outbreaks are small and the symptoms relatively mild in the affected individual. In 2015, links were documented and reported back between the Zika virus and Guillain-Barré in the individuals who contracted the virus and microcephaly in the unborn fetuses of women who contracted the virus. And how is this transmission occurring? It is primarily, although not exclusively, through bites from infected mosquitoes. We know, because it's been documented, that sexual transmission is possible, and this is the reason why we are educating, and you should be educating, the family members of your patients if they are younger or sexually active, that if they have been exposed, they need to be practicing safe sexual activity for at least 6 months. We know that there's a documented maternal-to-fetal exchange, and that this does at times cause the individual to have microcephaly. Other modes of transmission are currently under active investigation. And this is particularly concerning because a recent case was identified and documented in Utah where a caregiver of an individual, because of the intense, intimate nature of that caregiving, did transmit the virus. If that is proven, and if other cases similar to this are identified, the risk we are identifying to our potential patients and their caregivers is much higher than we currently are assigning it. So prevention becomes the most critical issue for us. What are the symptoms? If, in fact, a patient comes to you, a caregiver, which is more likely a family member or a caregiver, is visiting your patient and begins to exhibit symptoms, what are you likely to see? The incubation period is not clearly identified at this time, although it is expected to be or believed to be within the 7 to 14-day time period. A low-grade fever, some skin rashes, conjunctivitis, aching muscles and joint pain, a general feeling of being unwell, of general malaise, headaches. These symptoms will be mild, in a few instances moderate, and will last approximately 2 to 7 days. There really is no specific treatment at this time. A vaccine is in process of being developed, and they are currently using a repurposed West Nile virus vaccine for that purpose. It is not ready for use, so at this time, what we are doing is educating people to use symptomatic relief measures for their fever, their muscle aches, their general malaise, and reinforcing appropriate standard precautions in the home setting, particularly with this case in Utah. This is an indication that there is clearly a potential for the kind of intimate personal care that might allow for a blood exchange transmission or a body fluid exchange transmission, causing one of our patients, even though they're elderly, haven't been traveling to one of the affected areas, to become symptomatic. So let's look realistically at what our risk level might be. What is the risk for your average patient caseload? When we look at our CASPER reports, we look at our case mix picture. Our average patients, for the most part, across the board with all of us as providers in New England, our patients on average are over 80 years of age. They are medically homebound. They're not traveling for any period of time, if at all, to an affected area such as the Caribbean, such as southern Florida, Texas, any of those areas with heavy mosquito penetration. So the risk for the patients themselves is low to minimal for a direct personal exposure, as they are highly unlikely travelers to these areas. However, it is also the summer vacation time, and we don't know for a fact where their visiting family members may have been. And so the risk is a bit higher, although not even truly moderate, that you may identify one of their caregivers or visiting family member as being symptomatic. If it is a caregiver, particularly someone who is, as part of their daily duties, having to engage in intimate personal contact, then you do have a higher risk level. What about your staff? They are, particularly your home health aides and personal care aides, and in some cases your nursing staff, they are engaged in some instances in highly intimate contact, providing hands-on personal care, changing dressings, being exposed to the patient's bodily fluid. So the risk level is there, and it is that risk, while it remains low to minimal, that prompts us to say the best weapon in your arsenal remains a high level of competency in standard precautions. following standard precautions at the 5 most common points of contact, this is going to protect your staff in the best way possible. If we truly did identify a potentially exposed or infected patient, potentially exposed or infected caregiver or visiting family member, what is our responsibility in this situation? Our task would be, if this is our patient, to contact the patient's primary physician, report the circumstances, report the symptoms, and identify our reasons for believing we have a potentially exposed or infected patient. If the potentially exposed or infected person is a caregiver or a visiting family member, our responsibilities are somewhat different. We don't have the primary physician information for these people, so it is our responsibility to educate them that they need to contact their primary physician as soon as possible and to help them to understand what they need to identify and relay to their primary physician. Once that is accomplished, as an agency, as a reporter, you need to reach out to your local and state health department to identify to them that you have a potentially exposed or infected patient and that you may or are aware of a potentially exposed or infected caregiver or family member who is still in that area, providing them with contact information, providing them with the address, and answering any and all questions that the health department may have for you. Once you've done that, what else is our responsibility? As I said, it's our responsibility to work directly with our patients and their families and caregivers, but also to work with our community. When we deal in reality, not public uneasiness, not the immediate gut reaction to whatever they hear on the local news or in that tabloid paper at the checkout counter, reality tells us that the actual risk of contracting influenza or pneumonia is far higher than that of contracting Zika. But panic and general uneasiness from hearing it over and over, from there always being yet another, there's a potential case here, a potential case there, this person died in Utah, a baby died in Texas, these things make people very uncomfortable. And the higher their anxiety, the less receptive they will be to our calm, practical approach. So we need to reach out to them early and to provide the education that is their best defense. Reality tells us that influenza and pneumonia are a bigger risk. So we need to reinforce that. Reality tells us that our best protection is to follow common sense recommendations and maintain good standard precautions at all times. So we're going to encourage our patients, their caregivers, and their family members, especially those who may be traveling to infected areas, to follow the top 5 tips that we're going to talk about as a standard practice. From the previous presentation, these are the top 5 tips to vet the Zika virus. Use a spray. If you have standing water anywhere on your property, use an EPA-registered spray to keep the mosquitoes away. Drain the water, keep it cleaned up. Don't leave out children's pools in your backyard. Don't leave out empty spare tires. Don't leave something with a dripping plastic tarp over it that's going to collect a small puddle. These are all going to encourage mosquitoes to breed. Use air conditioning wherever possible, and check all of your window screens for a tight fit and no holes. As I said, remove all still or standing water. Cover up when you go outside. Wear clothing with sleeves, firm necklines, longer pants, tucked-in socks. I know it's been extremely humid, but the weather is not conducive to us wearing the appropriately protective clothing, but highly conducive to propagating more and more mosquitoes. So in addition, make sure that you are using appropriate insect repellents. Check the bottles carefully, make sure you get sufficient protection, and use them appropriately. Don't put it on once in the morning, go swimming at the lake, and then never bother to put it back on. Check the instructions. Reapply as necessary, frequently and carefully. If, in fact, you are sexually active in any way, make sure that you are using appropriate protection, using condoms, avoiding sexual transmission in any way that you possibly can. This is an education issue. Yes, it's personal. Yes, it's private, but it's a community-based education issue. Don't be afraid to tackle this topic. If you have any reason to suspect that you yourself, the patient you're caring for, a family member that's visiting, a caregiver, if you suspect any type of a risk or an actual exposure, call your healthcare provider and report it to the local health department. So really that's all I can offer today on preparing for the Zika virus, because truly our exposure risk is small, but we do want to educate everyone as much as we can. I'm going to shift our focus, as we always do, toward the end of our webinar, to the Million Hearts campaign. I want to talk a little bit more about how you as healthcare providers, as an agency, can support heart-healthy risk reduction. The company that I work for here at Qualidyne, based in Connecticut, in Vermont, and in New Hampshire, we are actively supporting the Million Hearts campaign by creating an employee health program that has agency-sponsored exercise with our noontime walkers up and down those stairs. We're going to be doing flu and a wellness clinic. We've had heart-healthy meals, and we've identified someone in-house who is looking on the internet for appropriate heart-healthy meal suggestions, snack suggestions, and activity suggestions. And I'm sharing this for a very important reason. Every single one of us, as home health providers, as community-based agencies, we need to practice what we're preaching. We tell our patients and our staff, don't smoke. Smoking is prohibited within 20 feet of the building. And then when we arrive for work in the morning, they can smell it. So we're not practicing what we preach if we're still smoking. As a home health provider, as a healthcare provider, you want to be posting up information about how you as an agency can help to connect them with smoking cessation support, a support group, a program, anything that will help them to reduce or stop smoking. In terms of exercise, talk to your human resources people. Is there a possibility that as an agency you can support a reduced fee to join an exercise group, to join a health club, to do something that would promote fitness and wellness? It doesn't have to be a marathon. It doesn't even have to be a race walker. Just a casual, comfortable pace, people walking together, talking about something, anything other than work. It's August. Flu season is coming back. Flu clinics, supporting flu shots, encouraging our staff to get immunized, and to look at pneumovax as well. This is something that as healthcare providers, we need to strongly encourage our agencies, employers, to support appropriate immunization. Whether you do it as a company-sponsored and paid-for event, whether you provide the insurance billing for it and offer it on site, time off to get to a flu clinic, a posted roster of flu clinics in your area, anything you can do to strongly encourage and reach out for a goal of 100% influenza immunized eligible staff. That should be our goal because it's critical for achieving heart health and wellness for us as employers, for us as community examples, and as healthcare providers. So I hope that you will join us here at Qualidine by designating somebody to be your HeartHealthy rep and moving forward to support positive steps in the Million Hearts campaign. As providers, we do want to try to reach out to one another. The 11th Scope of Work project has as its goal to improve the outcomes of our patients' episodes of care. I know that in recent years we've become more competitors than partners, but we do need to work together, sharing ideas, sharing how we are making things work better, and by doing that, everyone's outcomes can improve and our patients will experience better care. So I'm hoping that you are reaching out to one another, that you're sharing a process, sharing a new educational tool, a new resource, so that we can improve the cardiovascular outcomes, improve our success with smoking cessation, and just generally improving our patients' episodes of care, keeping them home where they really want to be. If any one of the agencies on our call today, if anyone on any of our previous calls, if you know of another provider who's doing something really unique and different, something that's just successful and better than yours is, if you're doing something that is being successful, please reach out to your state lead in home health because we would love to have you join us at our webinar in September and share what you're doing that is being successful. Anything that you can offer to one another in how you're improving patient self-management, patients understanding and taking ownership of their chronic illnesses, these would be wonderful opportunities for you to come onto the webinar with us and just share 2 or 3 minutes of where you found the resource, how you're using it, and how it's working for you. It would be a tremendous help to everyone. Remember also that on every third Thursday, an educational webinar is offered by the Home Health Quality Improvement website, by that group, related to improving cardiovascular outcomes, smoking cessation, improving your hospitalization by decreasing the numbers and the frequency. The next webinar will be September 15th. The topic has not yet been announced, but we strongly encourage you to go onto the HHQI website, get registered so that you'll get the reminders to sign up for the webinars when they come up, and also so that you can access the previous webinars that they have done. I especially want to point you to the training webinars that are available on quality assurance performance improvement. They have an excellent supervisor training series on the website. It is completely free, no cost to you as a provider. You can register yourselves, register your quality managers, register your clinical managers for this training that will walk them through the process, giving them a true understanding of the PDSA process, helping them to select a project such as getting ready for the flu season, doing a community webinar or a community presentation on cleaning up standing water, eliminating the risk of any mosquito-borne illness. So you can take advantage of this terrific series of programs on the HHQI website. Don't forget to reach out to your state leads. There is one for each state. Their contact information is on the QIN-QIO website. It's also in all of our previous webinars. And I hope that you will reach out to us because we really look forward to hearing from you, and we hope that we can help in any way that you need us. So that's all I have today. As I said, short and sweet. This is prime vacation season, which means we're all really short-staffed and trying to cover a dozen different things. So if anyone has any questions, I'll stay on the line for a bit. Olivia is going to tell you how to unmute and use the chat or any other way you'd like to present your questions. And as I said, I'll stay on the line for a bit to answer those questions. Olivia?
Thanks, Kathy. Also, Kathy, before I show people how to unmute their phone lines, if you want to press the one slide forward, all the state contact information should be there so people can access it from this webinar as well. And at this time, we'll take a few questions for Kathy. If you'd like to ask a question, you can pose it in the chat box, or you can press #6 on your phone to unmute your line. Kathy, if you go the other way, I think it should be slide 19. Oh, maybe 20. There you go.
Oh, there it is. Thank you. I knew it was there. Very good. So everyone's name and email address is on there. If there's anything that we can help you with, we would very much be willing to do that, to reach out, to make a site visit to your agency, provide a webinar or a desk share so that we can help you with getting linked into the cardiovascular land. Whatever we can do to help you, we're here to do that.
Again, #6 to unmute yourself, or you can pose a question in the chat box.
I'm not seeing anyone, Olivia. I think we'll let everyone know. They can have a quick lunch, and we're all set.
I think I hear someone.
Yeah, I do. Hi, can you hear me?
Yeah.
Yep, I can.
This is Margarita Shapiro with Richfield Visiting Nurses. I liked the presentation, very common sense information. The thing that I'm worried about is the lack of information that the CDC is sharing. And I've only seen this written on one bulletin, that for people leaving a Zika area and coming back home, that they should really be using repellent for 3 weeks after leaving a Zika area. So coming back from vacation, they really should be using a repellent to prevent, that's how to break the chain of infection, to prevent a mosquito, should they be an asymptomatic carrier, to prevent a mosquito biting them and then transmitting it. I'm just surprised I haven't seen more about that in the news broadcast.
I am too, because that would be an excellent public health piece for people that are traveling who've returned back to the States or within the States from an affected area. That's an excellent point. Thank you very much for bringing it up and sharing it with everyone, because that certainly is a risk area. And that's a very good suggestion that they should continue to use the repellent. This way everyone can add that to their community-based education. And if the CDC is not putting it out there, then we certainly can, as community providers, to do some education. Whether you do a simple, small handout even that you can do at any community activity and share it with the community, those are the kinds of things that we can do. Anyone else have a question?
Can you hear me?
Yes?
Hi, can you hear me?
Yes, I can.
Hi, I'm just asking, so like with, should we be asking patients, have they been, down in Florida in the past few months? I mean, are there any questions like they were asking about, I can't even think of what it was, but what they were asking. Ebola. Oh, there you go. I mean, should the providers and stuff start asking these questions?
I think that because the risk is so small, I did not find any materials that suggested that we incorporate screening questions into the admission process. Certainly for patients that you already have on service, you know that whether or not they have actually left the area. If someone exhibited symptoms, I think that would be an appropriate time to inquire. If a caregiver, a family member who is new into the household has the same symptoms, if it was that person that was exhibiting the symptoms, I think that would be the point in time that I would begin to ask those questions. Because our stratified risk is low in this area, I think that we would not need to incorporate that into an admission the way we did with Ebola.
Okay, thanks.
You're welcome. Anyone else?
Sounds like I don't think there's any more questions, Kathy.
Thank you, Olivia. In that case, I think we can close out for today.
Thanks, Kathy. I just want to thank everyone for a great discussion. I just have a few last-minute announcements before we end today's call. When you close out of this webinar, the evaluation will automatically pop up on your computer. If you could please fill that out, we would greatly appreciate it. You don't have time to fill out the evaluation right now, or you're currently sharing a computer with someone else, you'll receive an email tomorrow morning with a link to the eval, as well as a link to the event page on our website. The PowerPoint presentation is posted on our website, and within the next few business days, a recording and a transcript will also be added. And please be on the lookout for emails about our next webinar in September, which I'm pretty sure, Kathy, is going to be on influenza, correct?
It is.
Perfect. So be on the lookout for some emails about that, and I just want to thank everyone again for attending, and thank Kathy for a great discussion, and hope you all have a great day. Thanks, Kathy.
Thank you.